Welcome to the Heart Rate Variability Podcast. Each week we talk about heart rate variability and how it can be used to improve your overall health and wellness. Please consider the information in this podcast for your informational use and not medical advice. Please see your medical provider to apply any of the strategies outlined in this episode. Heart Rate Variability Podcast is a production of Optimal LLC and Optimal HRV. Check us out at optimalhrv.com. Please enjoy the show. Welcome, friends, to the Heart Rate Variability Podcast. I am back here with my dear friend, often guest of the show, Dr. Ina Khazan. Ina, how you doing today, my friend?
I'm doing well. Thank you, Matt. Always a pleasure to chat with you.
Awesome. I love the new office. Got some art back there, diploma. I love it. It's looking good. It is looking good.
Thank you. It's good to be settled in.
Awesome. Well, I'm excited to bring you into the series that we have been doing, talking about how professionals with this expertise around HRV biofeedback, integrated into their own practice. It's one thing to say, okay, we want patients to practice 20 minutes a day or 40 minutes a day or whatever it might be. It's another thing about how you take all this learning that you've done and integrate it into your own health and wellness practices. So I know firsthand you are a busy person. Not only are you a highly successful professional, your private practice, Harvard Medical School, trainings that you do, me bugging you around Optimal HRV. You're also raising three what seemingly are brilliant children with that MIT husband of yours. Just highly successful in their endeavors as well. So I'm really curious, my friend, let's start maybe just with HRV tracking that you do. How have you used and use, HRV as a metric in your own life to stay healthy and well?
Well, I gotta say, since optimal, came into my life, it's really been a game changer because I've started doing HRV practice in one way or another in 2002, 2003, something like that. It's been a really long time. Back, before I could even dream about, having something at home where I could measure things, right? It was, in the office, you go in, you do your measurement, and, since I had the equipment or access to equipment, it was a little easier for me personally, but it was certainly not something that I could even think about having at home.
Yeah.
And in the last 2 years, having access to a measurement has really been pretty incredible. I've been practicing, I've been doing my HRV breathing for over, 23 years, something like that, right? It's crazy how time flies. And I've been able to do measurements and I've been able to keep track of progress and data. But now that I can do this daily, um, it, it's really remarkable. It's like, it's in many ways kind of game changing. Um, what this tells me is just what do I need to pay attention to, like little nuances, the kind of stuff that I could never figure out before with like weekly measurement or maybe a couple times a week measurement that I would do it myself. Now it's just my reader is on my bedside table, next to my phone, and it's easy. I grab it, I take a reading, and it just gives me an idea of what do I need to pay attention to today. When I didn't get a very good night's sleep, I can see, well, how much did this affect my HRV? It's actually funny how while not getting a good night's sleep always affects my HRV to some extent, the effect itself, it does vary. Some days when I might get the same not great night of sleep, but some mornings my HRV is affected a little bit, and other mornings it's affected a lot. So those kinds of nuances that, of course I know that if I didn't sleep well, my HRV is affected, it's gonna duh. But how much it's affected makes a difference. And it tells me, do I need to, like, how much scaffolding do I need to build into my day? Um, I I realize there is a little bit of a self-fulfilling prophecy there, right? If I see a higher
Yeah.
number, I'm going to feel better about it, just by seeing that number, and seeing a lower number, it may affect how I feel as well. So I'm fully aware of it, but this is still really helpful. Helps me plan my day, helps me think, what kind of challenges can I take on, or, if this is a day with a lot of challenges coming up, I know when and how I need to build in, extra breaks, extra self-care, etc.
Awesome. So I would love to hear with access to HRV biofeedback earlier than most anybody else, being a practitioner yourself. I would love to go back to the early days when you first got your higher end equipment. What was it like I'm sure you probably got a little training before doing that. Just kind of using that, playing around with it on yourself. I'm really curious about some of those early months with that equipment in your office.
I mean, it was fun. It, it still is, it still is. But it was, this was when I fell in love with biofeedback, and this
Yeah.
was back when I was still figuring out what the heck HRV really is. And back then there was a lot more we didn't know about it. Still a lot we don't know about it back, but back 20 years ago there was a whole lot more. We were still learning, so it was fun to just see, well, what is my body doing, and what are all these measurements doing for me. In order for me to explain HRV to clients when I was first learning this, so I was introduced to this during training in graduate school. I was learning all sorts of things at the time, including just, how to be with clients, how to help them, what was most helpful, what wasn't so helpful. Um, and discovering the power of biofeedback, and particularly HRV biofeedback, was really pretty incredible. I was finding myself being able to help people that were at the end of their rope and kind of desperate. Nothing else was helping, and they were getting a benefit from this. So it was a situation where I had to practice on myself. Just because I wouldn't be comfortable
Yeah.
practicing on clients without first hooking up someone else, and me mainly, trying all those new skills. But also, this was definitely something that if I didn't know how it felt, I wouldn't be able to train clients. This is
Mhm.
absolutely a situation where I have to practice what I preach, or else I can't preach it effectively, right? I absolutely have to uh, try this on myself and train myself first. Because people have so many questions, and there is no way to answer them unless I've tried this myself.
Yeah. I'm just curious, how do you, because in clinical work, there's different sort of approaches of how much, self-disclosure that we do. In other words, using our own experience as, to supplement our clinical, work with clients. You know, in therapy we're told to do very little of it. Others, like peer support advocates, it's part of their work is because they have that lived experience. I'm just kind of curious, how you kind of use your learning curve with you to kind of work with clients, and do you bring in your own experience at all into your work with them?
Well, I think I at this point have probably done, have probably made every mistake possible. Although I'm sure that, in my next session I'm going to do something that I have not yet thought
Yeah.
of. But it feels like I've made every mistake possible. So that certainly goes a very long way, right? Because when things go wrong at this point, oh yeah, I've done that. I've seen this.
Yeah. Yeah.
This happens. Um, uh, and yes, as a psychologist, kind of that idea of self-disclosure is a little bit tricky, right? Because we're certainly
Mhm.
trained with, you do very little self-disclosure. Self-disclosure is frowned upon, and that view has been evolving over the last few decades as
Mhm.
well. But with biofeedback with HRV, I think it's crucial to have that experience, and to be able to share some of it. Certainly being careful to observe observe the appropriate boundaries, but just being able to say, yeah, that's happened. I've done that.
Yeah.
And this is this is normal, and this is part of what happens, and this is what you're doing. This is how you deal with it. So yes, I do share some about my experience because it helps people then refine their own practice.
I love that. So I'm curious, like as you start to hook yourself up, I'm assuming like did you go in maybe do a couple sessions on yourself a week? Like you have all that fun equipment there before, you could really take it home and do much meaningful stuff. Like did you just go in early a few days a week? Kind of how did you kind of practice, early on with the equipment?
Well, yeah, whenever I could sneak in a little bit of time, whether it was going in early or, in between clients, it was,
Yeah.
initially it was equipment shared with a whole bunch of other people. So
Oh,
whenever I could, sneak in when the equipment
yeah.
wasn't being used, I snuck, a couple of friends and, my father in at some point
Love
too.
it.
It was, important to practice on non-judgmental people with whom I could make all sorts of mistakes
Yeah.
and all of that being okay before I could feel comfortable really trying this with actual clients. So yeah, initially I hooked up myself whenever I could and snuck in friends and family because it was not equipment I could take home back then.
Yeah. So one of the things like that I really once I started resonance frequency breathing and integrating that in after probably practicing mindfulness for probably 12 years before doing that, I always kind of use it's a terrible analogy, but at the same time I can't think of a better one of like, I always felt like mindfulness, mindful breathing that I did over the years was like taking my autonomic nervous system, my ventral vagal system to the gym for a good workout. And is with resonance frequency is like going to the gym on growth hormones and steroids. I say it's a terrible analogy, but it's the best I've come up with because obviously, steroids and stuff, we're not saying go use that because of the negative side effects, but it was such a different experience, maybe a little bit during the practice, but boy, after, weeks of doing it, I'm just like, I just felt like I was getting a much better return on investment from my practice. And I kind of wonder, as you sort of went in and started regular practice, sort of just some of the things that maybe were some insights to you kind of along the way. Were you practicing mindfulness before you started resonance frequency breathing? Kind of what was your journey with that?
No, I was introduced to biofeedback before I even knew what mindfulness really was.
Oh,
That's
fascinating.
that's really funny, right? And
Yeah.
usually different the other way around for folks. Now I learned biofeedback and I knew a little bit about mindfulness, but biofeedback was kind of my first introduction into this world. And then started learning and integrating mindfulness and self-compassion and discovering just how well the two go together. Uh, but starting to do this back in graduate school, because I was learning so many new things, it just kind of gradually became part of life.
Yeah.
That's the nice thing about developing a habit is,
Yes.
it's hard to develop new habits. It's really difficult. And now when I look back at the last couple decades, HRV practice it's just what I do. And that's really nice.
Yes.
When people ask me, how do you cope with, child tantrums? I mean, those are far behind me too, for the most part. But, or, how do you cope with teenagers?
Yeah.
HRV is just such a go-to.
Mhm.
It's something that I kind of fall into that self-regulatory breathing pace almost subconsciously. It I remember, not non-sleeping babies, and what do you do with that? Like, well, you breathe, right? And
Yeah.
it just makes the whole thing, so much easier.
Yeah.
Now when I sit at my, kids' competitions and my stomach is in knots, what do? I breathe, right? This is This is just part of the process, and developing that habit is so worth it because developing the habit is hard and it does take some time. But
Mhm.
ultimately, if you think about, what's going to happen when you look back, 1, 5, 10, 20 years down the line, um, this is such a powerful tool that at this point comes pretty easily. It's just, part of what I do. And it's so worth taking that time to make this be a habit. Because, I fall to it, or I use that skill so many times during the day, many times without even really realizing it.
Mhm.
I have my regular formal practice, and this is just something I do during the day, multiple times for a little help and self-regulation.
I love it. So I'm curious along the way, as somebody who's now an expert on mindfulness, how did that come in? I'm interested on how that blending happened in your professional and personal practice and professional development.
Initially, those two were really, really separate. And if you think about what mindfulness teaches, which is just allowing things to be how they are, and biofeedback is all about making changes, initially
Yeah.
those two just seemed, completely separate. I learned them in the same place.
Mm.
During my training in graduate school at Cambridge Health Alliance, so
Oh, very cool.
a lot of these were coming in the same, like, sometimes um, like in the same day, I'd be
Wow.
learning these,
Yeah.
do a little biofeedback practice, do a little mindfulness practice, but the teachings seem like those two are completely incompatible, right? And if I talk to a mindfulness expert about biofeedback, I'd get a side glance, like, what are you talking about? No, the two are completely incompatible. But and I initially really did see them as very separate. And I'm going to practice this, I'm going to practice that, and I'm
Yeah.
going to teach this to my patients, I'm going to teach that to other kinds of patients. So this is going to be all very different. And over time, and really not very much time, but over time, what dawned on me was how just how incredibly compatible and how complementary the two are. If I had a client struggling with biofeedback, they were trying really hard, they were putting so much effort into it, they were and getting the opposite results, kind of the harder they tried, the
Yeah.
worse the results
Yeah.
were. Um, well, why not, bring in a little bit of, let's just see how it goes, let's just let things be, a little bit of mindfulness. And lo and behold, biofeedback goes so much more smoothly. And if I'm teaching mindfulness, to somebody who is struggling with severe anxiety and panic, where the idea of accepting that is
Yeah.
just totally unacceptable.
Yeah.
Right? They're just, no, don't want to talk to me about this. Like, I'm not willing, to accept this. Bring in a little biofeedback, and lo and behold, the intensity decreases, and like, okay, now I'm willing. Now I can
That's
let this
awesome.
be. So the two are just really blending beautifully. And it's that interplay between letting things be and goal-directed actions that really are a part of both biofeedback and mindfulness. We just have to be wise in where we apply choices and control, where we have control, and where we just really need to let things be. And it applies to biofeedback and to mindfulness equally, because certainly mindfulness is not doing nothing always, right?
Right.
Mindfulness is choosing, how we're going to respond, and with what action. And so is biofeedback.
So as you were getting this like mix, I love that that was a happening in this. I love this conversation because I knew none of this ahead of time. So as all that was kind of mixing together, oftentimes at the same day, like I'm curious, like, in schools you're learning all this. I can't see you hesitating too long to start a mindfulness practice and integrating some of this in. So I just kind of love to hear about, the mindfulness, part of this journey of how do you start to integrate that in to your life and your practices.
Mindfulness specifically,
Yeah.
yeah. Um, I realize that it's just easier to live with mindfulness. And I think initially, I did set aside some time for formal mindfulness practice. Uh, but I was doing biofeedback. I was also learning mindfulness. So I think my formal practice actually often went more to biofeedback, and mindfulness was initially something that I just kind of integrated into how I practice biofeedback, how I lived my daily life, how I responded to what was going on, how I approached stressors and challenges, and whatever was coming my way. So integrating that mindful attitude towards life was my initial approach. And then I started setting aside more time for formal meditation once I saw just how incredibly helpful a mindful way of life
Yeah.
is.
It's that skill I don't think we talk. I mean, you do, but like sometimes I think we just throw out the word mindful and we're picturing someone sitting in meditation and that skill that at least for me I found like the more I practiced intentionally, the more that skill developed. So yeah, the toaster oven doesn't work, but is it really worth throwing a fit about the toaster oven? Is there anything I can really do about it? And it's just that mentality that I has just been transformative for me over the decade and a half, 2 decades now that I've been serious about my practice. It's like, yeah, the things that were stupid triggers are no longer triggers, and the things that are real triggers, we were talking about what's going on in the news right now. I can at least acknowledge that, yeah, this is a trigger and I need to go sit and breathe a little bit and make sure I get my evening practice in tonight.
Exactly. It lets you choose how to respond to that trigger instead of
Yes.
just reacting.
Yeah.
Right? Because, we're not going to get rid of triggers. Some things, like non-working toaster ovens become just like, oh, well, you know what, I don't have to have my bagel toasted, or I can
Yeah.
go buy a new one.
Not the end of the
Something.
world.
Exactly, exactly. And some things will always be triggers, as they should be, right? We certainly don't want to mindful mindful ourselves into not caring, right?
Yeah.
Mindfulness does not equal not caring at all. Like that's not at all what
Right.
mindfulness is. Mindfulness is oftentimes caring very, very much. And choosing how we're going to respond to that, right? Is throwing a tantrum helpful? Well, no, not at all. So mindfulness helps us figure out how to respond to that. If there is a trigger, is it helpful to take it out on your spouse or on your dog or on your neighbor or on your coworkers? No, not helpful at all. So, how do you respond to those triggers is what mindfulness is all about. How do we care? And how do we care deeply and respond in helpful, healthy ways?
I love it. So I'm curious of little things that maybe you have found along the way. Like I know with the biofeedback practice and optimal zone, boy, if I just like keep the posture that I had while I was watching TV and just start breathing, maybe I'm getting in the 60s. If I sit up and in the typical meditation position, all of a sudden I'm in the 90s. Like, and I know some of that can be individual for people. And so I'm just kind of curious, as especially like maybe with the fact now that you can do it at home, you can do it all the time. I'm just curious, are there things that you have evolved on as far as your approach to mindfulness and biofeedback kind of in your own practice that you've been able to kind of hack along the way to get more benefit out of your practice?
Well, certainly, having a mindful approach to my biofeedback practice and a compassionate approach to my biofeedback
Yeah.
practice is key because, I still have a human mind and that mind wanders off, and might be doing my practice and suddenly start thinking about, oh no, I forgot about this meeting I have tomorrow. I didn't prepare enough for it, right? Things,
Yeah.
enter my mind. What happened actually just this morning, when I woke up a little bit earlier than I needed to, and I was decided I'm going to do some HRV practice just because I have time, and why not?
Yeah.
And a thought suddenly occurred to me. I have a biofeedback workshop coming up in a few weeks, and there's a detail that I've had completely forgotten to take care of, right? So this just like flew into my mind, and
Yep.
of course completely threw me out of optimal zone,
Yep.
and that's okay, right?
Yes.
That's normal. That happens, and I kind of made a mental note. All right, I'll come back to that, and really focused on it's okay for me to be in wherever percentage of low frequency I'm in right now. I was for some moments I was in low, optimal zone, right? I
Yeah.
was just not in it at all, and the approach is that's okay. I'll come back to this. I'll remember. Let's refocus and just bringing myself into that moment with kindness, with compassion towards myself, and not beating up on myself for forgetting this thing. That's pretty important. Also, not beating up on myself for getting kicked out of optimal zone, right?
Yeah.
That's okay. But just kind of refocusing and allowing my nervous system to settle back in. You know, allowing optimal zone to happen kind of on its own. Because if I tried, if I put effort into it, I wouldn't have gotten there. Like, that
Right.
again, that's that, paradox of mindfulness, right? The more you try, the worse it gets. So I really just needed to let my nervous system settle in and get back because I knew it could. And that's
Love that.
exactly what happened. Um,
Love that. Yeah, it's so funny. I almost like because I'm still not at the place where I can just clear my head. Like I would love to get there at some point. I just don't. I, I don't know how I like, but it's almost like I need to take out the trash, like mentally. Like yeah, I catch myself. I come back to the breathing, but it's almost like the thing I catch just needed to like get out so I could get back to my breathing. It's like, and occasionally, like you had this morning, there's a nugget that pops up. Like, oh, I was throwing out something to value in this trash. And like, okay, I should make a note of that, like you did, and come back to it because that was something important. But it's just such an interesting experience to pay attention to those thoughts in that non-judgmental way. Yeah, there it is. Okay, I need to throw that out. No, that's not serving me any good right now. Let's go back to the focus on the breath. But it's the mind's an interesting thing.
yes, and it's fascinating to track it. A thought coming into my mind, throws my,
Yep.
cardiovascular system, out of whack, right? That's a pretty incredible mind body connection, and I absolutely love being able to see it so clearly, with HRV and with the optimal slider.
Yes.
That feedback is immediate.
Yeah.
When we're focused and present, everything is nice and green, and random thoughts entering your mind will you'll see an immediate effect on what's happening, and that in itself can throw you off a little bit, but it's also just really valuable feedback, not because you're doing something wrong. It's not pointing out mistakes or failures, but it's really just telling you this is what your mind and body are doing in this moment, and how amazing that we have the ability to track it with that much precision moment to
Yeah.
moment
And
and get
then
to know
like
ourselves better.
you may be able to do this because of but as especially, I think we've had the slider out now for maybe coming towards a year, but not that long. This has been integrated into my practice in that way. It's like okay, I see myself go out since we roll on that 60 seconds. Sometimes the thought or the sneeze or whatever it might be, whoo, I go like you see that drop, and then it's like okay, and to watch it go back because you're kind of working that sneeze or that thought out of the 60 seconds, but then just that the kind of the hyper focus. I'm not saying I'm necessarily working, but training's a great word because it's like, okay, yeah, I know the breath that gets me in optimal zone. I know the breath that keeps me in optimal zone. So I can apply all those skills to get that autonomic nervous system regulation that without it, like, just totally different. And now I'm learning to apply it in other situations without having to pull out my phone. But it's that training aspect of it is just so amazing.
I think in getting to know that how my nervous system works, how my mind works in that, year or so that, the
Yeah.
slider has been out, I've learned a ton about my own body, about my own mind.
Yeah.
So much more than I was able to learn in the previous couple of decades where, most of my biofeedback practice up until then was not done with actual feedback, right? I didn't hook myself up every single day. My equipment lived in the office, even if I
Yeah.
had it at home, it's somewhat cumbersome. It wasn't something I did every day. I did my practice every day, but most of the time it wasn't monitored practice. And now is being able to so easily just track what happens. I thought I knew my nervous system pretty well, but I've learned so much more about it.
That's
And it
awesome.
really helps in the moment, right?
Yes. Oh,
Even
yeah.
in moments when I am not hooked up to any equipment, just, having that knowledge, understanding how I respond to things and what's helpful and what's not, having
Yeah.
that feedback during practice times, I now know
So good.
how to use those skills in challenging moments.
Yeah.
And again, that's been a game changer.
I love it. So let's start to wrap up on this. To walk me through what a day, what a week looks like with your biofeedback mindfulness practice. Well, what have you sort of evolved into with all this training and knowledge you've gotten over the years?
Well, one thing I'm guilty of is not having a consistent time for my practice as much as I encourage my clients to find one. And I did back when I was first establishing a practice. I did, back then. These days my schedule is just a little too unpredictable, and
Yeah.
none of my days are consistent. I don't do the same thing, at the same time each day. That just pretty much never happens. So I have to adjust my practice to that. Some days I wake up a little early in the morning and I have time. All right, this is a great time for my practice. Other times, it's something that I do before going to sleep. As far as my formal practice goes, some days are incredibly busy, and I have to, kind of make a mental note. Okay, this is where I can fit this in. There are days when it doesn't happen. It just again, in the full disclosure, there are absolutely days when I don't have time for formal practice, but I do get, 5 or 6 of those a week, most weeks.
Awesome.
And then it, some days I have my full 20 minutes. Some days I only have time for five.
Yeah.
And 5 minutes is certainly better than no minutes, right? I
Yeah.
always make time for something, but some days, life is such that 5 minutes is all that happens. And that's okay. I also just do little practices throughout the day, in between meetings, if I have a couple of minutes, especially if one of those meetings is particularly challenging. I know this is just something that helps me transition from one to the other. If I've had a really long day, I'm in transitioning to a really long work day and then transitioning to home day, right? Or, home evening.
Yeah.
Just having a few breaths or, a couple of minutes, if I'm in my, Boston office like I am now, on my drive home, it's a great time to do a little bit of breathing. But some days when I work from home, my commute from my office to the kitchen, right?
Yeah.
In those days, it's particularly important for me to take a few minutes just to let my nervous system settle, and let go of what was happening during the day and to be as present as possible for my family. At this point, my habit is to just kind of figure out where is this going to fit
Yeah.
day to day. My fallback is always if my day is such that I did not have time for formal practice at all, there's always at least 5 minutes before bedtime.
Yeah.
Usually more, but that's always my fallback. If I didn't have time, this is this is where the practice will always fit in.
I love that. And I love that. I love these conversations because, Dr. Gerverts was kind of the same way. It's like, I think a lot of times because we are so invested in getting people to practice just the understanding that, hey, it's not easy sometimes to find that time. I definitely respect that with children in the house. Like I don't have children in the house, so that schedule is has a lot more flexibility to it. As you go to your daughter's gymnastic meets around the country, all those things that are getting kids ready for school. I kind of got to get my hair fixed, and my routine takes about 3 minutes in the morning, so it gives me that flexibility, but just trying to find really meaningful ways to get it in there, whether it's 5 minutes at night or there is 20 minutes on a Saturday where you do have that time to yourself where you can do that deeper practice and be kind in between, what all those look like for you. So,
Exactly. I think that kind approach is key, right? Because if you don't have time for practice and you're beating up on yourself for it, well,
yeah.
that's certainly not going to help your HRV
Not
or your nervous system,
good.
right? That's uh, yeah.
Yeah.
Rather than spending that time beating up on yourself, do 3 minutes of HRV
Yep, there you
practice.
go. There's some good time to do it. If you're
Yeah,
feeling shameful, take that breath. So, well, my
exactly.
friend, I appreciate you. I've been looking so forward to this conversation, and just learning more about your journey has been a pleasure and a joy as well. So, as always, thanks for being such a good guest and supporter of the show. And yeah, I'm excited to see where this takes us, because that optimal zone slider has been such a big impact, I know, for a lot of people, and it's just fun to see where we can utilize this science to really give people that tool, again, whether it's 3 minutes, whether it's 30 minutes of practice a day, and giving that little bit of insight which can be life changing is just so cool. So I appreciate taking this journey with you.
Yeah. Thanks, Matt. Always a pleasure to talk with you.
As always, you can find show notes at optimalhrv.com, and we will see you next week.